Sudan knew voluntary and volunteering work since all ages and appeared as a social values and cultural behavior in the Sudanese communities in its traditional form, even became a basic string in building communities. Humanitarian Relief Foundation is a global non-governmental organization established in 1991 in Bradford, United Kingdom, and has activities in different parts of the world such as Somalia, Iraq, Jordan, Pakistan and Sudan. The office in Sudan was established in 2003. It is working in Khartoum, Darfur, Western State, and Geneva, its capital. The organization works in fast response to disaster, emergency, development aid, sustainable livelihood, and humanitarian peaceful dialogue in areas of conflict. It is also works in education, health, ensuring orphans, emergency and training program, and seasonal projects, such as fasting meals and Zakat al-Fitr and sacrifice. According to its vision, everyone enjoy a safe and a decent life and to achieve a lasting improvement in the quality of life for all people regardless of gender, race, religion, class, or political affiliation. The head office of the organization in Khartoum is divided in two units. The program unit is responsible from writing proposals project, getting fetch. The program unit is responsible from writing proposal projects, getting support and managing programs at the country level and follow-up projects implementation in Khartoum and Darfur. The second unit is administration and finance section. It is facilitates financing, procurement, contracting and removal of financial petty cash for program. Darfur Western State Office was established in 2011 to work in health, capacity building, and the seasonal projects. The organization manages 4 clinics, 2 clinics in Riyadh camp for primary health care and maternal and child care and productivity health. It serves around 20,000 immigrants in addition to 9,000 citizens nearby the camp. The third one in a Jabal neighborhood near Abu Zar camp, and it serves around 26,000 immigrants in addition to 12,000 citizens in the nearby neighborhood. And the fourth clinic in Al Aidin area, Beda Province, West Darfur State. It serves around 7,000 citizens in addition to 20,000 from 13 villages. The Humanitarian Relief Foundation provide primary health care, productivity health, productive health, pregnant and obstetrics, immunization for children and pregnants, health service through health education, nutrition service through its 4 health clinics. The foundation provides all these services free of charge for all citizens and also medicine out of its pharmacies existing in the clinics. As well as the foundation is implement training programs for skilled health workers and apprise the grassroots level to these communities. In addition, it is developing capacity of national and local organizations working in humanitarian and voluntary field, whereas the foundation gets some support from Suez Embassy in Khartoum. The organization has several agreements and memorandum of understanding with the Ministry of Health in the state and UN agencies such as the World Health Organization, UNICEF, and the UN population to the implementation of many projects.
In fact, this is a considerable type of partnership work achieved by the United Nations International Fund for Population and Humanitarian Relief Foundation in the state of West Darfur. And this joint work characterized in different categories such as providing medical equipment and medicine for the clinics in Al-Riyadh, Al-Jabal and Tarbeba. Also, the joint work comprise allocation of financial support to undertake gynecology activities. Also, the joint work comprise allocation of financial support to undertake gynecology activities through rehabilitation of gynecology section in the state of West Darfur in Al Riyadh camp, while Humanitarian Relief Foundation take responsibility of fistula therapy. The United Nations Population Fund, in cooperation with West Darfur Ministry of Health, is to build a complex of fistula free of charge surgery, while Humanitarian Relief Foundation undertakes upgrading of health awareness workshops to support patients to recognize the available free medical services and education.
When Sudan faced floods and rains disaster, the Humanitarian Relief Foundation undertook its duties by providing relief materials for the devastated areas in the state of Khartoum, which severely affected by floods and rains. Program section of the foundation performed a visit to Al-Hamda area of the Eastern Nile locality, which highly devastated, where all people lost their homes. Through meetings with popular administration, the foundation noticed the vital need of sanitary urgent reforming plan for better health by digging and constructing new sanitary municipals for Al-Hamda area, in addition to the food supply distributed to the people. The Humanitarian Relief Foundation also provides training and upgrading programs for the national humanitarian organizations in Khartoum River Nile and West Darfur in the field of projects administration, urging for financial support, report initiatives, and methods of performing surveys and reports writing. In a considerable contribution, the Human Relief Foundation distributed food and relief materials to the victims of the recent incidents in Abu Korshola at the state of South Kordofan. The foundation sponsored a number of orphans in Khartoum, River Nile, and Kassala state, and secured the adequate financial and technical needs for them and their families. For the near future, the foundation is to extend its humanitarian activities to cover several areas in Darfur, Blue Nile, Southern Kordofan, in addition to new plans of implementing development projects in Eastern Sudan and Darfur, by participation of people in planning, implementing, and evaluation projects. The foundation enrolled in partnership with civil society organizations and other popular groups in order to upgrade their capacity and finance them to implement the proposed projects. The purpose projects of the foundation strategic plan